Yeah, the most common reason people need joint replacements are that they either have arthritis. Some of them had trauma early on in their life and they sustained damage to their hip or knees. Especially around the knees, some of our younger clientele were weekend warriors or warriors in high school and college, and they beat up their knees to the point that they're now hitting their baby boomer years and they're paying the price. I use the analogy of a tire on a car, and we were blessed with 4 tires when we were born with perfect treads, and if you bang around those tires, they will wear out. And the earlier we bang them around, the quicker they wear out. And that's basically what's going on. So that's another form of arthritis. Rheumatoid patients, patients have rheumatoid arthritis, usually need to have hip and knee replacements. Most commonly, it's just a wear and tear from osteoarthritis. Well, basically the process is first identifying that you have a problem, which certain people have a hard time figuring out that they have a problem, or they're in denial that they have a problem. But when they finally make the decision to come and see me or any orthopedic surgeon, normally what we'll do is we'll do a complete history and physical evaluation of the patient and get x-rays. And we put the pieces of the puzzle together and then come up with a plan of how to make things better. Well, a knee replacement, as I stated earlier, it only takes around 30 minutes to do. We try to avoid general anesthesia. The patient can get up and ambulating on their knee the day of their surgery, would probably be in the hospital a little longer than a hip replacement, and it is slightly more painful than a hip replacement is. But the pain is well controlled with the medications that we give, and we try to avoid narcotic pain medications any longer so we don't get the side effects. But patients can get up and ambulate on it right away. Most people walking with a walker for 3 to 6 weeks, a cane for 3 to 6 weeks, and then nothing. As far as a hip or a knee replacement, usually takes around 30 minutes to do. When it comes to hip replacements, it's usually done under a spinal anesthetic, so we try to avoid general anesthesia at all costs. The patient will be up and walking on their hip the day of their surgery, and some patients will go home the day after their surgery. Most people are walking with a walker or crutches, whatever they're more comfortable with, for up to 2 to 3 weeks, a cane for 2 to 3 weeks, and then nothing. Knee replacements are slightly different. Knee replacements we usually do under a local block. So we don't do any general anesthesia, try to avoid any spinal anesthesia. Patients are usually in the hospital a little longer, anywhere from 2 to 4 days. And the recuperation takes a little longer because it's a little more involved surgery. Most people would walk with a walker or crutches anywhere from 3 to 6 weeks, a cane for 3 to 6 weeks, and then nothing. Some people are very, very surprised that, it's all patient-driven. There's lots of advertising out there of different prostheses, different techniques. It really has nothing to do with any of that. It has everything to do with the patient. If you want to get better, you can get better very, very quickly. If you're a couch potato and you know who you are, it takes a long time to get better. If you wait for people to make you better, it just takes time. You will get better, and the pain will go away. It just takes longer. And if you're driven, like I said, with a hip replacement, the day of your surgery, you're up and walking, and the next day you can go home. A knee replacement in and of itself is personalized to everybody. When we go into an operating room, whether it was 20 years ago, 10 years ago, or today, the prosthetic components are made to fit their specific bones. So we have all different sizes and shapes and lefts and rights. We have ones made for women. We have ones that rotate. We have all these things. So a lot of the advertising that we're seeing on TV is basically just advertising. It's trying to get you to buy into something that you really don't need. The prognosis and the benefits of a hip or a knee replacement is it does give back the patient a quality of life that they've been missing for a long period of time. If you can imagine not being able to walk, that really does make people very, very miserable. So giving them back that ability makes them very, very happy people. But there is some time you have to put in to make yourself better. And that's what people have to realize. It doesn't happen overnight.